rather than 65 বছর, but globally this number is 65. তাছাড়া high risk population হলো people with diabetes, people with hypertension which is uncontrolled, heart disease, kidney disease, liver disease, all people who are on chronic medications for a background chronic problem which is to an extent uncontrolled would merit the terminology of being in the high risk category of disease. So high risk in the way of age. So for us in our guideline we have put a cutoff of 50 বছর rather than 65 বছর, but globally this number is 65. তাছাড়া high risk population হলো people with diabetes, people with hypertension which is uncontrolled, heart disease, kidney disease, liver disease, all people who are on chronic medications for a background chronic problem which is to an extent uncontrolled would merit the terminology of being in the high risk category of disease. So high risk in the way of age, high risk in the way of population. Now the other category which I don't get to see is between 6 months of age and 5 years of age. তা একটা আমরা বললাম 65 বছর, আবার আমরা নিচে বলছি 6 মাস থেকে নিয়ে 5 বছরের মধ্যে. So the pediatricians see, and there also the incidence of influenza is very high, and there also prevention of influenza is an important thing to think about, but I'm sure we'll come to that soon.
Yes, actually that was my next question.
I think people are much more conscious now about getting vaccinated as compared to what they were before, and I think diseases which are vaccine preventable, influenza being a primary disease there right at the top, is important to speak about vaccination. So vaccination for influenza is important. The other things which are important in the prevention category are all things that we have done well during COVID. You know, things like masking, especially when you're in crowded places, especially when it's the high risk population that we've talked about, crowded places at airports, flights, malls, cinema halls, stadiums. All of these places are crowded places, and if there's someone with an important comorbidity, and you all know that we are the diabetic capital of the world, so people with diabetes which are not very well controlled, for instance, would want to do masking. Hand sanitization is easy, and all these respiratory viral illnesses, including influenza, including COVID, spread the same way as COVID does, which is aerosol generated. If you hachlo, if you kashlo, a distance of 6 feet is where the aerosols would spread and transmit disease to others. So that's
give us some medical trial data or something which can substantiate that there is no
I'll give you.
মারো তো ওয়াইড
Am I okay to stand up and say? Is that okay? So, you know, this vaccine hesitancy that you just spoke about a little while ago actually stems from the fear that the vaccine would have an adverse. You understand that? That's why vaccine phobia, vaccine hesitancy, these terms have come into being. And a lot of it have been reports of clots in the lung, for instance, in people who have been COVID vaccinated with a certain brand of vaccine, and we won't go into the brand. But it's been reported across brands. Now put this into perspective. If you think about the number of people who died with clots in the lung globally, it's about 1 in 150,000 people who died from a clot in the lung. Right? It's a cause related to vaccination. Any clot in the lung, someone
role of vaccination, and these meetings are done directly with the doctors or in collaboration with medical societies. Secondly, we also started a campaign way back in 2017 called as MAI, M-A-I, that is Mothers Against Influenza, where we educate pregnant women about the need about this particular disease of influenza and the need of vaccination. We also tap into the media, like the way we are doing out here, whether the print or the radio, also the social media, Instagram and the Facebook, to spread awareness of this particular disease. One more perspective what we are doing out here from an awareness is about school-going children. So at the beginning of the academic year, somewhere in the month of June, we go to various schools, we educate the parents that their child needs to be vaccinated so they can protect themselves from this particular disease and its complication. So this is a journey which we all have begun, and it's a continuous phenomenon for all of us to ensure that the high-risk population and this vaccine preventable disease is being addressed in the right manner.
Thank you, Dr. Tito.
The second barrier what we clearly see out here is that there's a limited knowledge about awareness of vaccination amongst the doctors as well as in the patients. If I take the high-risk population, even today, like I spoke, emphasize on a particular point, there is, after the talk of Dr. Rajadhar, it is very clear that there is evidence that in a high-risk population, what Dr. alluded to, typically the elderly population, more than 65 years of age, patients with diabetes mellitus, patients with a cardiovascular disease, like patients with hypertension or myocardial infarction, patients with renal disorders, or patients with respiratory disorders like asthma and COPD. If these patients are vaccinated, there's a 50% less chance of hospitalization if they are infected with influenza. And that's the reason this high-risk population is very important that they need to be vaccinated. Similarly, if I look at the pediatric age population, children less than 5 years of age, if they are vaccinated, there's a 57% less chance of hospitalization if they get infected with influenza. And the most important population, that is a pregnant woman, if they are vaccinated, there's 20 to 30% less risk of preterm birth if they're infected with influenza. As you understand, preterm birth is a birth of a baby before the term of the gestation. So all this evidence clearly suggests that if these people are vaccinated, all this influenza related complications and hospitalizations can be avoided. Now coming to the barriers about why, although we know about this particular disease, we know about the prevalence which Dr. Rajadhar clearly alluded to, we know about the prevention by vaccination, still there are big barriers. What are those barriers? One of the barriers what we see out there is that influenza or flu is still being considered as a common cold. It is something which will just come and go. But the fact is, influenza or flu is caused by a specific type of virus which is called as the H3N2 or the H1N1. If I take globally or if I take in India, it is a major public health problem for the simple reason influenza can be a serious respiratory disorder which can